Hello, I'm Bonner. This is Olivia. We're from Move to Move. We're going to demonstrate a modified COSSACK, PAILS and rails. If Olivia just wants to show us what the COSSACK position is, depending on how flexible you are, the COSSACK position is really one bent knee and one straight knee, and the knees should be pulling away from each other. So if you weren't able to sit in this low position, sometimes people will have a higher position, so they would straighten out this knee, and that might be as far as they can go. The way we're going to do this is modified with a yoga block. So what's going to happen is Olivia is going to sit on the yoga block, and from here she's going to make sure the front heel is on the ground, and she's getting a little bit of a stretch through that ankle on the front leg. But really what we're focusing on is working on this back leg. One of the things with this is you can bias a few different rotations of this hip. So if her thigh or her kneecap moves towards the front of the room, this is what we would call internal rotation. If her kneecap moves to the back of the room, that's external rotation. So you can play with it and you can see where you get a better stretch. Either if you're in external rotation, when you do your PAILS and rails, you'd probably be looking at more of your hamstring. If you aim for that internal rotation, you'd be using more of the groin, okay? So talk to your therapist, your trainer, and see what's going to be most important for you to work with here. But for this video, we're going to focus on this internal rotation. So she is working more on the inside of the leg rather than the back of the leg. She would hold in this position for time, and then when she is done for the hold, it's usually around 90 seconds to 2 minutes, she's going to do a PAILS. So the PAILS is going to be pushing the foot into the ground, and that will utilize all of the tissue on the inside of the leg to make that happen. And you would ramp that up from 20% effort all the way up to where your therapist says, usually 80 to 100% effort for a certain amount of time, usually 10 to 30 seconds. And then the rails. So the rails is, without anything moving through the rest of the form, trying to lift the entire leg off the ground. If you're in your passive end range, it's not going to lift, but you're going to use all the tissue on the inside part to try to lift that leg off the ground and hold that effort for the amount of time you've been told by your therapist.